I'm the philosopher in residence at Baycrest. I don't do anything, I think. That's a philosopher's job. Mostly what I do is I work with people who are doing things, who are nurses or doctors or recreation therapists. And what I try to do is to help them understand how other people think about the work that they do. A good example is recreation therapists try to get people motivated in their work at Baycrest. They try to get people to dance, for example, whereas nurses believe that people should have autonomy. So what happens on a ward is that Mrs. Goldberg is lying in bed and she doesn't want to get up. And the nurse says, well, if you don't want to get up, you don't have to get up. And the recreation therapist comes and says, Mrs. Goldberg, come and dance. And the nurse says, don't push her. And the recreation therapist, come on, Mrs. Goldberg, you'll enjoy it. And Mrs. Goldberg gets up, and the recreation therapist kind of forces her to dance, and then Mrs. Goldberg has a good time. What happens very often is that the recreation therapist doesn't understand what the nurse is thinking about, and the nurse doesn't understand what the recreation therapist is thinking about. So very often there's a miscue between them, and they don't understand each other's premises. Mostly I'm a translator in those discussions, that I try to understand what the premises are that people have when they work with people, and try to understand what it is that motivates them. Usually what happens is that everybody who works with people is altruistic. Everybody has a very strong altruistic bent. They want to do good. They want to help people. And they're trained in a certain way. And they're told in their training that what you do is you motivate people, for example, or what you're told in your training is you give people their autonomy, or you're told in your training that you have to have, that when you do therapy, the therapy has to have an outcome. Those kinds of questions and those kinds of premises are ones that very often other groups don't understand. They don't understand other people's training. They don't understand other people's motivation. What about Mrs. Goldberg herself? Is she the kind of person who needs a little bit of pushing, or is she the kind of person that you want to leave alone? And so one of the things that's interesting about, I think, about thinking about interventions in geriatrics especially, is that you have to know the particular person, who they are, what they want, what they're like, what kinds of things would get them to act in certain ways, and what kinds of things would be destructive.